Hello, my name is Vanessa Russell. I'm an occupational therapy student at the University of Utah, and today I will be providing you with a brief overview of traumatic brain injuries and discussing a few common functional limitations that you may see when working with this population. So, traumatic brain injury, abbreviated as TBI, what is it? Essentially, it is when an external force causes changes in brain activity and function, leading to impairments in function. In the table, you see different causes of brain injury that vary depending on age. The external force causing damage to the brain may be a direct blow to the head, leading to localized damage, as seen on the image to the left. The force can also be from a sudden deceleration of the body and head, leading to widespread damage, as seen on the image to the right. The type of injury, whether local or diffuse, as well as the location of the damage, will determine the resulting impact on function. Impaired function can result from physical, cognitive, visual, perceptual, and psychological changes, once again depending on the location of the injury. Here is an overview of some common factors which negatively impact physical functioning. We will take a closer look at each of them. Muscle tone, which is the contraction of a muscle when at rest, may be either high or low. With high tone, there is increased resistance against movement from an outside force, which impairs the person's ability to voluntarily relax the muscle. Low tone is essentially the opposite, where there is little to no resistance to an outside force. With low tone, the ability to voluntarily contract the muscle is impaired. Some muscles may have more or less tone than others, which can cause postural changes. These images demonstrate some posture imbalances. The top two images show high tone at the hip and trunk. You can see that the tone is decreased after getting an injection. Although not as clear, you can also see that the woman has high tone in her left arm, as her elbow is consistently flexed and held tight against her side. These posture imbalances, along with high and low tone of specific muscles, can impair an individual's ability to perform many daily tasks, such as walking, reaching, and grabbing. Additional impairments include decreased reflexes that normally maintain balance and are used to catch yourself when falling. This can be caused by high or low tone, but not necessarily. Muscle weakness, as well as decreased reflexes, increase risks for falling. They may also have difficulty coordinating body movements, especially of the head, neck, trunk, and limbs, which may present as jerky movements and difficulty maintaining balance in seating or standing while moving multiple body parts, such as when reaching or bending. Additionally, there may be decreased range of motion at any joint. This chart demonstrates examples of some range of motion actions. Decreased range of motion can be caused by a number of factors, including tone and pain. Sensation may also be impacted. It can either be decreased, increased, or have an inappropriate sensory response, especially to touch. An example of having an inappropriate response would be someone may feel pain when they touch something that is cold. Difficulty controlling facial muscles and swallowing mechanisms can impact swallowing and eating. Moving on to cognitive function. Here is an overview of some of the things that may be impaired after a TBI. It is by no means comprehensive, but they are some of the more common impairments you may see. Attention and concentration changes can result in difficulty concentrating for long periods of time and filtering out distracting information from the environment. Memory changes contribute to difficulties learning new skills and pose safety concerns as they can get lost easily, leave doors unlocked, or stoves turned on. They can also have difficulty remembering events before the accident or forming new memories after the accident. Safety awareness and judgment may be impaired, leading to an inaccurate perception of abilities, and they may attempt to do things beyond their abilities, which can lead to additional injuries. They can also be impulsive and act without thinking, like crossing the street without looking. Delayed information processing can lead to delayed responses. Higher thought processes can be impaired as well, such as abstract thinking, planning, and setting goals. They may take jokes literally and need clear examples and explanations. Applying new learning to other situations, also known as generalization, can also be difficult. Performing routine tasks in different situations and settings may be challenging, as they may be able to perform a task in one environment. When any aspect of that is changed, however, it becomes more difficult for them. Next, we will discuss vision impairments. This is a depiction of the underside of the brain that shows the branches of the 12 cranial nerves. Circled are those that are responsible for seeing, the optic nerve as well as eye movements, nerves 3, 4, and 6. Damage to either of these can cause impaired vision. Highlighted here is the occipital lobe of the brain that is responsible for processing visual information. Disruption to the cranial nerves mentioned previously or the occipital lobe can result in impaired vision. There are many different factors that cause vision problems. These are only a few of them. Deficits with accommodation or adjusting the eyes to see near or far causes blurry vision. Having a visual field cut can affect either one or both of the eyes. It looks like a blank section in the vision as seen in the center of the upper picture. It can make things like moving around in the environment as well as driving difficult. Many different movements of the eyes can be affected as well, some of which can make reading difficult along with maintaining an eye gaze and scanning the environment. Some of these are displayed in the bottom image. Here are a few of the things that can be challenged with a TBI in regards to perception. Perception is the ability to interpret information from the external environment. Visual perception is the ability to identify an object. With visual perception deficits, they may have difficulty discriminating between right and left, recognizing familiar objects and faces, and identifying objects or people from the background. In this image, can you tell what the green circle is with the yellow background? For someone with visual perception difficulties, they may have a hard time identifying it as a tape measure or that it is on top of a stack of paper. Body schema is being aware of the spatial characteristics of one's own body, so being able to recognize where your nose is in relation to your arm or foot. With this impairment, using objects on the body can be difficult. Imagine trying to brush your hair without understanding where your hand with the brush is in relation to your head. Language perception is the ability to comprehend and form language. Aphasia is a language impairment. Within aphasia, there are several different types. Two of the more common are non-fluent, also known as Broca's aphasia, and fluent, or Wernicke's aphasia. With non-fluent aphasia, language is understood, but producing speech is difficult, and it may take some time for them to vocalize what are they wanting to say. With fluent aphasia, there isn't a problem with speech production. They may talk without stumbling on words, but they don't necessarily make sense, and they may have a hard time making sense of what they are told. Dysprosody has to do with the tone of speech. They may not be able to express or understand emotion through tone variations. With a traumatic brain injury, changes in a person's psychological functioning and social involvement impact how they feel about themselves and their relationships. Psychosocial impairments are viewed as one of the most detrimental changes of a TBI, as the person and their families experience pretty drastic changes to their previous ways of living. Self-concept, which consists of personal identity, body image, and the understanding of personal strengths and limitations, is the most difficult to manage as the individual may have to rebuild their concept of who they are. Some describe it as an unwanted death and rebirth. Closely tied to self-concept are social roles, such as being a mom, a friend, a coworker. Physical and cognitive changes from TBI can prevent them from feeling fulfilled in these roles as they once had. Living arrangements for individuals can also be changed. Families may have to move in or out in order to assist the individual. All of these add to the stress that the individual and their families experience. Individuals and their families can also go through a process of mourning that is similar to what people go through when mourning the loss of a loved one. Individuals may also experience changes in their affect, such as depression and mood, as well as emotions. To recap, TBI impacts psychosocial, cognitive, vision, perception, and physical functioning in various ways and to various degrees depending on the type and location of injury. I have briefly skimmed the surface of some of these things and hope that you have been able to find something that will be helpful for you when working with students who have a TBI. This is my reference, and if you have any questions or comments, my name once again is Vanessa Russell, and there's my email. Have a great day.